In Module 8, Part 2, I will continue the topic of auto accident cases and LOP cases from Module 1. The topics that I will specifically be covering in this module are attorney intake, treatment protocols, MRI referrals, orthopedic referrals, and how to manage a case. So I want to continue with attorney and how important it is for you to obtain attorney information from your patient. It's good for you to establish a good relationship with the attorney or paralegal. Most of the time, you're going to be dealing more with a paralegal or case manager rather than the attorney, unless it's one of those smaller firms or more personal firms that you will be speaking directly to the attorney. But most of the time, you will be really dealing with a paralegal, whoever's in charge of managing your patient's case. So it's good for you to establish a good relationship. Make sure that they understand who you are, that they really know the name of your company, that you know what you're doing. So if you establish a good relationship, the more likely they're going to keep you in mind when it comes to referring some of their new clients. Okay. It's also important for you to keep updated on patient's case. So sometimes patients, they're just coming to treatment with you, and there's different things going on when it comes to an auto accident case. So you want to be able to keep updated on their case. You want to be able to call to see if it's still open, if it's a closed case. Maybe the patient is not being represented by that attorney anymore. So you always want to keep updated. You can call the attorney if you're missing any important information like insurance, especially claim numbers. Sometimes patients do not have their insurance information with them. Maybe they don't want to give it to you. Maybe they give you the wrong one. So it's always important that you always call the attorney and verify, make sure you have the correct insurance information. And if they don't want to give it to you, you can always call the attorney and they should be able to give it to you. Okay. If patient is non-compliant, you can also contact their attorney to let them know that their client is not coming to their treatments. This is very important. Sometimes attorneys, maybe a lot of times attorneys are not going to be calling your office too much when it comes to updating themselves on the patient's treatment. They'll call every now and then. It depends on the firm. So you don't want them to call one day and asking for their client to see how their treatment is going, and you tell them that, oh no, your client has not been here in over a month. They will go crazy. If you see that the patient has not come into their treatment and the magic number is 3 or more missed appointments, call the attorney after you've of course already tried contacting the patient. So call the attorney, let them know, hey, your client is being non-compliant, they're not answering my phone calls, they're not coming into therapy, or whatever the case may be. That way the attorney has the chance to also try to contact their client. Okay, it's not going to be something that's a surprise to them. Update the attorney with medical records via fax or email. So some attorneys are going to want medical records every week. Some of them want them maybe in the middle of the treatment. And some attorneys are not going to want anything until the very end of the treatments, okay, until their patient has been finalized. So you want to make sure that whenever the attorney does need medical records, that you're able to update them with those medical records, okay? If patient does not have attorney, give them the option of receiving information to get one. This is called an unattached patient. So attached versus unattached patients. So an unattached patient is a patient you receive that already has an attorney. Okay, so really this is just an attorney. They're trying to see where their client can go for treatment, and they send them to your office for treatment. And there's not much else you can do there except make sure that you handle the case correctly and that you give a good first impression to that attorney, especially if it's an attorney you've never worked with. Now, unattached patient, which can become very, very, it can be something that you can definitely use to your advantage. A patient is a patient that you receive that does not have an attorney. And the good thing about this is that it allows you to send to an attorney you already work with, or you can use that patient to establish a relationship with a new attorney. So this patient comes in, of course, they were in an auto accident, they need treatment, they were not at fault, and they don't have an attorney. You can tell the patient, hey, would you like some information? There's a lot of benefits to you having an attorney, so you can receive proper compensation for your injuries due to your accident. And you can refer that patient to either an attorney that you already work with and you just want to keep sending them more patients, more clients, Or maybe there's an attorney that you've been wanting to establish a relationship with, and this is your chance to do it. You can send them a new client. Okay, so definitely always keep those things in mind. So the intake. So for motor vehicle accident patients, the intake has three extra forms. Okay, this is only for auto accident cases and for and the yellow P for either auto accident cases or for slip and fall patients. Okay, and these three forms are extremely important. They always have to be included in the intake. The LOP letter, which is the one that you send to the attorney to get signed, like I mentioned in the part 1 of module 8. The AOB, which is the assignment of benefits. This is a patient giving us permission to bill their PIP insurance. And the standard disclosure. It states what procedures were rendered and that there was no soliciting involved. And remember that this form is signed by the patient and by the therapist. And make sure that after you scan the intake in, that you do store the standard disclosure somewhere, because you have to keep the original form. Okay, that one you do not shred. Everything else you can shred except that one. So at the time that the patient is filling out the intake form, remember to explain to the patient what to possibly expect in their treatment. Okay, if the patient understands what their treatment consists of and what it takes to make a good case, then your patient is more likely to keep coming back to their appointments and to be compliant with their treatments. So it's very important that that first visit you explain to them what it is that they have to do. So the trick to that is not really telling them exactly what's going to happen, in the sense of like that's what's going to happen because this is how we treat every single patient. You have to tell them first you're going to be evaluated today, then you're going to start treatment. Eventually we might send you out to do an MRI, and then when we get the MRI results, depending on the results, we might have to send you to a specialist if your results are positive. And mind you, most of the time the results are going to be positive. There's always something there. You don't have to say that part to the patient, but there's usually always some positive findings in the MRI. So once you get those results of the MRI, then we might have to send you to a specialist, and the specialist will tell you what the options are, okay? And then you have to be finalized. So you have to go through all those steps in order to create a case that your attorney can present, and also so that it can help you get better. Okay, so the patient doesn't come in, they're not going to get better if they don't come into treatment. So it's a win-win situation. They get a good case, and they're going to feel better. So always schedule recurring appointments. Very important for every single patient, especially for auto accident patients. Auto accident patients, they are typically treating for about 3 months or so. So I would say to do about three times a week for 12 weeks, okay, an appointment. So just so that they continuously get reminders every day or every other day that they have an appointment. Schedule for EMC right away if you know patient does not have one. Okay, if you remember the emergency medical condition form. If you know they don't have one, that first visit when they're filling out their intake, make sure that you send out a referral or you get them scheduled to do an EMC. So treatment protocols. A patient will be first evaluated by a physical therapist, and they will begin treatment. They need to be reevaluated every 30 days, just like every single patient. In about 4 weeks into their treatment, you want to start setting up for an MRI. After you get the results, you want to set up for an orthopedic consultation. And after they've seen the orthopedic, depending on what the ortho and what the patient decide on, either more therapy, a little bit more therapy, or injections or surgery, depending on the patient's case. Then at the end, when everything's done, you need to get a final report from the orthopedic doctor. And if you have a chiropractor, you can also get a final report from both the ortho and the chiro, or vice versa, just one or the other. And then you have to do a discharge summary. Most motor vehicle accident patients are discharged at about 35 to 40 visits. That's about 12 weeks. And that's if the patient is compliant and comes to all their treatments exactly how they are scheduled. So MRI and orthopedic referrals. chiropractors can write up referrals. So if you work with a chiropractor in your office, the chiropractor can help a lot when it comes to managing a case because you kind of keep everything in house. They come into treatment with you, they see the chiropractor with you, the chiropractor can refer them out to do the MRI, they can also refer them out to see the ortho, so everything kind of stays in your control. If you don't have a chiropractor, that's fine. You have the option of sending the patient straight to an orthopedic, and the orthopedic can basically kill two birds with one stone. They can do the referral for the MRI, and they're also the orthopedic, so you can do it that way as well. And always call the attorney before sending the patient anywhere. Okay, if you're going to refer them out for an EMC, if you're going to refer them out to an urgent care, to an orthopedic, to an MRI. Every time you're going to send out a patient to an MRI or an orthopedic, always call the attorney and ask them if they have preference. Some attorneys are very picky. They have preference as to where their client gets sent to. So you definitely want to call and find out. If they do not have a preference, then you're free to send them wherever you want to establish some type of relationship or wherever it's closer for the patient. Okay, but definitely call the attorney. They make a huge deal out of this if they find out that their client was sent somewhere without their approval. You can pretty much lose that contact with that attorney. So when you are sending out a referral for an MRI or an orthopedic, try to get the patient scheduled while you're in the office, if it's possible. So if you already know what center you're going to send the patient to for an MRI, call the location right there in the office while the patient is with you, and put the patient on the phone and have them scheduled right there, right in front of you. Because sometimes the MRI office or the orthopedic office will try to contact the patient, and they're not able to contact them. Maybe the patient's busy, not answering the phone, they don't recognize the number. So if you do it right then and there when you're in the office, you would definitely 100% be able to schedule that patient. And make sure you know the date of the appointment. And the reason why you don't want to know the date of the appointment is so that you know when to follow up, right? You can follow up to make sure the patient went to their appointment, and if they did, you'll know when to ask for the report. And some MRI centers are really good. They'll send you the MRI report right away automatically without you having to request it. But there's some centers that you have to call and request to make sure they send it to you. After you receive the MRI, patient has to follow up with the doctor that referred the MRI to get the results explained. So once you get that report in for the MRI, you want the patient to see that doctor again, whoever referred the MRI, whether it's the chiropractor in your office or the orthopedic who referred the patient out to do the MRI, or a regular urgent care doctor. You want to make sure that patient does follow up so that that doctor can see the results of the MRI and also explain it to the patient. And if there are any positive results, then that doctor can give the patient a referral to see a specialist, an orthopedic. And when they see the orthopedic will give the patient options either to continue physical therapy, maybe get injections, maybe even surgery. Okay, and the patient will also decide on what they want to do. And then at the end, when everything's done, the orthopedic doctor will do a final report with an impairment rating. And the chiropractor can also do a final report with an impairment rating. Okay, and this is your goal, is that final report with an impairment rating. That's your goal, because that's what's going to pretty much wrap up the entire case. That impairment rating is what the attorney, like I mentioned before in part 1 of module 8, that impairment rating is what attorneys use to settle the cases. Okay. So managing a case, this is just a summary of managing a case if you ever want to use this as a little bit of a guideline. Okay, patient needs a PT prescription. So that's the first thing. You want to make sure that the patient gets a physical therapy prescription. Then you want to schedule the patient for an initial evaluation for physical therapy. Get patient scheduled for an EMC within the first 2 weeks. And as a manager, like I've mentioned before, I would just do it that first visit. But you definitely want to get it done within the first 2 weeks. After about 4 weeks, get patient referral for MRI and make sure they are scheduled. And I say 4 weeks. This is just a general timeline. Okay, some patients are gonna need MRI way before that because they're in so much pain that you need an MRI right away. Some of them you can wait a little bit more depending on what the circumstances are. So, but just to keep it uniform, I would say about 4 weeks into the treatment, okay? Request the MRI report and make sure patient gets follow-up with the doctor that referred the MRI. Depending on the results, the orthopedic or whatever doctor referred will give the patient options. So if it's a regular doctor that has sent the patient out for an MRI and they are reading the results, they might, and there's positive findings, they will refer the patient out to a specialist, which would be an orthopedic. And or if they were already being seen by the orthopedic and the orthopedic was the one that referred the patient to do the MRI, that depending on the results, the orthopedic will give them options as to whether to continue a little bit more therapy, to do some injections, to do surgery, and the patient also gets to choose what exactly they want to do. The orthopedic will then do a final report with impairment rating. Make sure that you request all records. So if you make sure you have all your MRI reports scanned into the patient's file, make sure you request all orthopedic records and scan it into the patient's file. You want to do a discharge summary. Apart from the final report that gets written by the doctor, you want to also do a discharge summary for the physical therapy part. And make sure you send all records to the attorney, including the billing ledger that can be requested from the billing company, which is Quick Collect. So once everything is done, you want to call the attorney and let them know, hey, your patient was finalized. Who can I send all the records to? And they'll most likely give you the information of the person who's in charge of the case. They're most likely going to be the ones that are going to want all the records. That way they can do their part in creating the case for the patient so that the case can get settled. So some side notes, keep in mind that not all cases are the same. So a lot of these timelines that I'm giving you, it's just general. It's just something that we like to follow, and it's probably the easiest way to teach it. But every case is completely different. Some patients are going to come to you from another, maybe straight from the ortho, or maybe they've already done a lot of therapy. Maybe they already did surgery, and now they're coming back to you for physical therapy. So make sure that you understand how you can use these different things. They might be in different orders, but at the end of the day, all of it is included in the patient's case, whether it's MRIs, orthopedics. Some patients are not going to want to go through with the case. Some cases are dropped by the attorney. So you just want to keep that in mind, that all cases are not the same. They're all very different. And managing an auto accident case takes practice and experience. This is the only way you're going to understand how to manage different cases, is by actually doing it and by practicing it. And once you do a few, it becomes a little easier. Remember, these cases are the most challenging, like I said, and they require the most time and organization. They're very tedious. Retention. Call attorney after 3 missed visits. Retention is very important for auto accident cases. Auto accident cases pay very well. The PIP pays very, very well. So you definitely want to make sure that your patients are coming to treatment like they're supposed to. Always call the attorney before sending patient anywhere. I repeat this again because this is very, very important in order for you to keep that good relationship with that attorney. That will make a huge difference. Always call the patient before you send the patient anywhere. And that's the end of Module 8, Part 2.